what do you feel, that thought of nothing to leave behind? What is your thought on this?
Now with this technology, with this thought that we don't leave the stent behind, so which means we leave the drug inside but no stent inside. And this technology is known as drug-eluting balloon, which is done with a drug-coated balloon. Now we in many cases where there is no stent and the patient has come with a blockage for the first time or the second time, and if there are 2 blockages, 3 blockages, 4 blockages, in all these situations now we are using drug-coated balloons with equally good results.
What do you feel for that? What is the future of
I think my final message is that it has a great future. The technology is working all right. Now it has been tested in thousands of patients.
So hello friends, I am Dr. Nagendra Singh Chouhan. I am working as Senior Director Intervention Cardiology at Medanta, the Medicity Hospital. Today we will be discussing about a new technology. So we all know that for blocked coronary arteries, when there is heart attack or when there are blockages, we are using stents for so many years and they were really successful. But there are certain limitations, and now over a period of time practice is changing, that if you leave something inside, that can be a problem for future. So practice is changing toward a new technology which is called drug-eluting balloon, and for this I have none other than Dr. Praveen Chandra. He is the chairman of cardiology at Medanta, the Medicity Hospital. He has the vast experience in interventional cardiology and in drug-eluting balloon technology also. So we'll have a discussion on this new technology for patients, that is how it is beneficial, where it will work and how to use it. So what do you feel that this technology is of the thought of nothing to leave behind? What is your thought on this?
Yeah, so interestingly, the field of interventional cardiology is rapidly advancing, and the first advancement was balloon angioplasty, which came in about after the 79-80s or so, and then we are having a lot of reblockages, so we started putting stents, but stents also had blockages, so we started putting drug-eluting stents. So what the purpose was drug-eluting stent was to prevent reblockage. But the problem with the stent was that it had to stay inside, and that would create problems in the future. So now with this technology, with this thought that we don't leave the stent behind, then how do we do that? So which means we leave the drug inside but no stent inside. And this technology is known as drug-eluting balloon, which is done with a drug-coated balloon, where we take the balloon inside, which is kind of painted with drug. The drug is loaded onto the balloon, and then when we inflate the balloon at the site of blockage, the drug goes inside. And then the blockage is cleared, but at the same time, the drug prevents the reblockage. So that is the advantage of drug-eluting balloon. And then what happens is, once the drug is absorbed, after 3 months, then there is nothing inside. The artery remains completely natural. It will function completely natural, and then there is no effect. The late side effects of stents are gone because there is no stent inside, and there is no risk of a stent thrombosis, which means having clot formation inside the stents, etc. So all the complications of stents are now easily avoided by the help of drug-eluting balloons.
So what do you feel? The technology was there for so many years, and with every year now the new brands are coming, multiple companies are coming with their own brands of drug-eluting balloons. So do you feel the effect is a class effect, or like there are sirolimus drug-eluting balloons, practical balloons? So what do you feel?
So definitely with every technology there is a development phase. So we are in the, I must say, about the second or the third phase of development, where we have understood that this technique works. The drug-eluting balloon works. Now the question is, which is the best balloon? Whether there are so many types of balloon, what technology is going to work, what doesn't work. So here we have seen that those balloons which are coated with drugs like paclitaxel or everolimus, they are working. And out of them, the drugs which is helping more right now is paclitaxel. The data is more in favor of that. But at this time, again saying that even everolimus or sirolimus, both are working all right. We are waiting for some more trials to come in so that we will know which one is the best one. But right now, paclitaxel seems to be having an edge over the sirolimus eluting balloon.
So with this data and with your knowledge, what do you feel that which drug should be used in which patient? Like if patient has already a stent and now he has come with a blockage, or if there's a de novo blockage, if there's side branch blockage, how do you choose that I have to use this particular brand in this patient or this particular drug especially in this patient?
So we are now in those patients where there has been already stent which has been put and it has come with a reblockage, or too many times angioplasty has been done and they are coming with reblockages. In these cases, we take paclitaxel eluting balloon, and now there is a balloon which has folds. So the drug is actually loaded inside the folds, the 3 folds of the balloon, and when the balloon goes inside, because many times it was happening that the drug was coated on the balloon and while they are putting the balloon inside, the drug washes out. So it doesn't reach the blockage site. That was a challenge. So this challenge is now being managed by this technology of the fold technology, where the drug is loaded on the balloon, and it is now going to be available very soon, the data on this, and if it shows that it is the best, maybe this will be the best out of the whole lot, where paclitaxel is released with the folded balloon, and this is now being tested in a study with protege balloon, which is a drug eluting balloon. So hopefully it will be positive.
So coming to the more advanced thing like stents were there, and do you feel that this technology will change the way we are treating the patients, or it will replace the stents, or in a de novo lesion where till now we are using it in the restenosis only? So in a de novo lesion, what is your experience with?
So earlier we started using drug coated balloons for restenosis lesion, which means that the blockage has come in a previously employed stent. Now we are in many cases where there is no stent and the patient has come with a blockage for the first time or the second time, and if there are 2 blockages, 3 blockages, 4 blockages, in all these situations now we are using drug coated balloons with equally good results. So many times we have done angioplasties in 3 blockages without no stents, 0 stents, with drug eluting balloon only, and it is working. So this is known as de novo angioplasty with drug coated balloon, and the advantage is that in those patients where we cannot give double antiplatelet therapy for a long time because of bleeding issues, because of elderly age population, because of any surgery which is going to happen, in all these cases it is very, very helpful to use drug coated balloons and then get their further treatment done for their other problems, and also avoid any severe bleeding complications.
So with all this knowledge and with your experience, what do you feel that to our doctors who are using it and to our patients who want that this technology to be used, how they should choose it or doctors should choose, how you decide, and what kind of message you want to give that which are the best patient when it is to be done?
My message is that every patient today, although this data is still little bit premature that whether we can use it in all patients or not, but given a choice, according to my experience, according to the outcomes which we see, that given a choice, I will say that drug eluting balloon will be preferred over drug eluting stents, and maybe in future only stents will be implanted if the drug eluting balloon is not working or if there is a issue there. So which means the use of drug eluting stents may come to about 5 to 10% or 90% may be drug eluting balloons.
So it's very important that if this technology works and if you do it properly and if the lesion is prepared well and there is no problem, then doctor can definitely decide and do this procedure in many more patients. So definitely the choice is of doctor, that he has to take the final call that what is the problem with the lesion and how it's prepared. But if it works, then this is really a phenomenal technology. And I think, what do you feel for what is the future of it?
I think my final message is that it has a great future. The technology is working all right. Now it has been tested in thousands of patients, and we are looking at medium term and long term outcomes also. And today we are at the situation at a verge of this change where about more than 50% patients are today in our practices are being treated by drug eluting balloons, and the advantage with that is that the patients can live without any issue of any hassles of taking medications for lifelong, and they can just enjoy their life like a normal person. And of course, if sometimes the other last advantage is that if sometimes a surgery has to be done, surgery can also be done to these patients without any issue. Yeah.
So I think there is no doubt about it that this new technology has phenomenal future, and with the advances now we know how to use it, so we can use it in many more patients. So with this we want to conclude this discussion, and we know that definitely this technology will work and many more data. So definitely we need more data, but this is a phenomenal technology. Thank you.
Thank you very much.